Hello, my name is Hao. I'm very happy to share you our work, Contactless Oxygen Monitoring with Radio Waves and Gated Transformer. This is a joint work with Yuan, Yingcong, Peng, and Dina. Oxygen saturation is a physiological signal which refers to the amount of oxygen in the blood. Normally, it ranges from 94% to 100%. Low oxygen level can be dangerous, thus it is important to monitoring it for patients at a high risk. Currently, measuring oxygen requires wearing a pulse oximeter on the finger. It can be impractical in some scenarios. Sometimes people may forget to use. Very old adults may suffer from dementia or cognitive impairment. Some people may be unable to measure. For example, patients recovering from COVID-19 may experience delirium. Further, pulse oximeter is known to have bias on skin color and tend to overestimate oxygens in black people. In this work, we explore the possibility of monitoring oxygen by using the radio frequency signal. We call our system RF oximeter. It has two benefits. First, it does not require any physical contact or wearable device, thus does not burden the patient. Second, it does not depend on light, thus has no bias to the skin color. The key idea in our design is to use breathing signal as an intermediate representation. To get breathing signal from radio signal, we use an existing algorithm developed by the wireless sensing community. To estimate oxygen saturation from breathing, we train a deep neural network on multiple medical datasets, which has paired breathing signal and oxygen measurements. As a result, our model is significantly outperformed prior works on predicting oxygen levels. It has the highest correlation and significantly reduced errors. Now let me show you an example of our prediction. Here the black line shows the ground truth, while the blue line shows hours. Overall, our model accurately checks the trend of the oxygen saturations. Further, in the second row, we zoom in to a 15 minutes period where the oxygen level varies a lot. Clinically, a drop of oxygen over 3% is considered as an oxygen desaturation event. The number of the desaturation is an important biomarker. Our model is able to capture all the events precisely. Lastly, I want to share a primary study on the skin color bias. The figure here shows the distribution of the oxygen. Interestingly, the ground truth measurement shows a clear discrepancy between the black and white subjects. This is compatible with the finding that pulse oximeter overestimates blood oxygen in subjects with dark skin. In contrast, our model has a similar oxygen distributions for both races. It suggests our method potentially is a way for non-biased oxygen measurement. Of course, more rigorous clinical study is needed to verify it. For the technical details and full result, please check our paper. Thank you.